Excellent, excellent. The questions that we were supposed to ask actually pulled up the wrong document. Stefan, do you have that available, or I can get it?
Yeah, I have it here. Let's see. I have the healthcare subcommittee, the names that we want to talk about, but oh yeah, what are the goals as a subcommittee? What specific topics do we want to study, and what learning sessions and speakers do we want to engage? So I guess we can start with the goals of the subcommittee.
Perfect. Yeah, I think that's a good starting point. I mean, Commissioner Velarde or Commissioner Ramsey, do you have initial thoughts in terms of some of the goals of the subcommittee?
Well, for me, I think we should really look at the mental health component and how it impacts our communities, and as well as areas around treatment and disparities. We talked about disparities in the criminal justice system. We also know those same disparities exist in healthcare, and I think those are. I think often these are the disparities that we deal with in the criminal justice system are a result of all the other systemic disparities that exist, and this is one that definitely feeds into some of the issues in the criminal justice system.
I agree. I think the issue of mental health and substance abuse treatment and resources is going to be an important issue. One of the things that I think could also be a topic that we work on, and it might be overlap with the education group, is that certainly for communities that are of color or immigrant or not English language proficient, having seeing healthcare professionals that are representative of their own communities is very important as well. It's important as far as sort of community education on topics, and also them having somebody that they can come back to and talk about their problems. So I think certainly we need to look at issues of equity as far as representation among the healthcare professional provider community.
I think listening to you, I mean, it makes total sense to me. I think there's probably an opportunity to explore workforce issues that make sure, how do we make sure we have a culturally competent workforce? And some of that might be related to educational attainment and training opportunities and credentialing. The other piece may be related to how scope of practice issues restrict the ability to make sure you have accessible professions. I spent a lot of time earlier in my career working on adding mid-level dental providers to the team, and scope of practice issues were a huge issue because it was really the dental association trying to prevent opportunities for other types of providers, whether or not it's hygienists to progress in careers, or other states and countries use something called the dental therapist, which is someone that provides a culturally competent provider, provides routine preventive care. Tribes use them a lot. So I think that makes sense as a whole. How can we make sure that we have a health system that allows for the recruitment and retention and hopefully career laddering of professionals, so that we're addressing some of those disparities and also creating jobs? So I'm fully on board with that idea.
And also, do you want to look at any like Medicaid expansion issues? And
yeah, I wonder if a goal is for us to look at how can we create a system that's sustainable from a financial standpoint, and how can we reduce barriers to care and services, so that we can get at some of the disparities, across different topic areas. I wonder if we can create a sustainable system through recommendations on how to change some administrative laws, look at funding opportunities, and then obviously policy recommendations like coverage expansions. Because I do think there's a lot of opportunity for us to take a deep look at what are the inequity, what are the barriers to people, particularly people of color, accessing services in the system. Some of it may be eligibility policy, like we haven't expanded Medicaid, but some of it just may be like there's not culturally competent street level bureaucrats to interact with them. So how do we make those recommendations? And that might be something that Medicaid can do without much money or without going through the Kansas legislature. So to me, I think it's how can we look at this from a systems level. Well, I feel like from that high level, does that make sense in terms of trying to think of different systems to reduce disparities and improve access to services is sort of a goal?
Yes.
Yes.
And then I think the conversation we all want to be in is where we were with the topics. Some other things that I was thinking about, because I agree, behavioral health makes sense, substance use treatment makes sense, workforce I think makes sense, a lot of sense. I was thinking that we could probably get into maternal and child health, sort of getting at things like prenatal health in terms of what type of services and care mothers, particularly mothers of color, are getting prenatal all the way through 5. I think it's a really important area. Gets at some of the items that Shweta had highlighted in terms of ACEs. So how can we make sure that we have a Medicaid program that is, or a healthcare system, I don't want everything to be about Medicaid, supporting new, young kids and mothers so that we can make the most upstream investment to combat any adverse childhood experiences and investing in young children's mental health early versus having them manifest in, dealing with a life of trauma. So I think that those early investments would be great to look at, from home visiting programs to screening for depression, and then there's coverage issues. So I think sort of understanding the maternal and child health stuff would be important. I know Chief Ramsey's doing some really cool pilots in Wichita with DCF. So I think trying to understand how we can use resources to keep kids out of foster care and to have cooperation so that law enforcement has tools to help make sure there's supportive environments. I think digging into the intersection of health and child welfare would be really exciting, because I think law enforcement touches that too. I think that might be a place. Workforce, I love. And then there's probably some different coverage pieces to look at, but I'm sure that's a lot, but there may be other things to add.
Yeah, I just thought of this along with, sort of issues that are tangential to law enforcement, like mental health and substance abuse. I mean, do we want to take a look at any issues of intrafamilial violence? I mean, certainly those are factors that can have a significant impact on the family and child development.
Yeah, I mean, I think that.
Yeah,
Go ahead.
Sorry. Yeah, thanks, Steve. Yeah, I think that's a great point. We know that oftentimes, number one reason, number two reason for ER visits for women is domestic violence. So that's a great point. And then when you talk about the trauma, long-term trauma on kids that are raised with violence, around violence like that, and how that impacts their overall health, I think that's a great topic as well.
Yeah, me too. I think that's wonderful. So let's add that to the list. Other ideas for this brainstorm? I mean, I think we have, the good thing about this is it seems like we have great resources and we have time to dig into these issues over the course of the year. So I think in some ways there's also the overlap with some of the other work groups. There's sort of ways all of these things are connected too.
Yeah, and likely we will be, add different items that come along. I can think of some great topics that I would like to hear from the experts on that probably will have a fair amount of influence over our recommendations and maybe even moving our focus.
Yeah, I agree. Is there, to make the transition, I know we'll have time to go back and forth. Is there experts that anyone's thinking of now that we should make sure we have sort of out of the gate to start with? I know that there was some list sent around last night, which I think is a good starting point. But I didn't know if there was some folks that you knew you wanted to hear from or that we should hear from out of the gate.
I think one of the groups that I work with here in the Kansas City area, El Centro, they have a group of community, they're like community organizers and health educators. They call them promotoras, like health promoters. So these are moms and women who are your neighbors, and they're the ones who kind of help disseminate information on COVID, on healthy meals, on this, that, or the other. So I think it would be I don't know if there are similar agencies with similar with persons in similar roles in other parts of the state, but it would be good to hear from them as to like what their challenges are, what they wish they had, as far as additional resources, sort of what they're seeing in the community are the needs. So that might be a good place to get at least a lay of the land.
I think the El Centro is great, and the promotoras or the community health workers fit into that workforce bucket as well. So I think, but there's so much more than that in terms of they're really connecting folks to services that are oriented towards social determinants of health. So I think El Centro would be great, and maybe we can pull from the Community Health Worker Coalition as well.
Yeah, I would also maybe want to meet with or invite groups to speak with the commission that are the licensing boards for different professions, whether that be respiratory care or nursing or what have you, and see if they have, seeing what they're doing as far as efforts to have diverse representation in their profession, whether we can talk to them about them developing a plan to make their organizations and their professions more representative.
I love that idea.
That's kind of my day job, is helping with the appointments to these boards. And part of what we've tried to do is make the appointments to the boards more representative of historically marginalized groups. But I think that's an excellent idea. And I think I can be a conduit to get all that contact information. If you want to invite executive directors or board contacts, we can do that. One thing to be aware of, those boards are often just focused on the licensing and regulatory side. So just be aware they may come at it from the perspective of, we're trying, but all we do is we just license and regulate and make the exams for these professions. So just something to be aware of.
So on that note, do you have a recommendation of who might be the right people to talk to? I mean, do we need to talk to the colleges that are putting out, nurses and respiratory therapists?
That could be. I think maybe the groups, universities, associations that often support universities or help get students into careers would be helpful. So I think A, the boards, and then B, universities, but also, yeah, I think that could be adequate.
Okay. Cool.
I just had a question. Are you interested in engaging national experts or people from other states to present?
Absolutely.
Okay, so I did have a lot of suggestions for states that we've engaged in our different projects at NGA, so I could send those along, states that are sort of models around, specifically around addressing adverse childhood experiences, upstream prevention for social determinants of health. And within Kansas, we at NGA operated a learning collaborative on children's cabinets and cross-sector collaboration for children's health and success. And one of the participating states was Kansas, and we did a lot of work with the Kansas Children's Cabinet and Trust Fund. And I was wondering, do you think that would be a good figure as well?
I think that the cabinet could be good. I think we need to sort out in some ways how what we view as health and what education group views as education. But I think either the cabinet or one of the three agencies that make up sort of the interagency working group between child welfare, health and environment, and education might also be good just in that MCH focus. So I think the cabinet and or I think definitely KDHE and DCF. I think it's whether or not it makes sense for the cabinet for this piece if Dr. Anderson's not bringing it along. But I think national experts would be great. One thing that I'm trying to think through is knowing that we can make administrative recommendations is looking at some of the national groups like CLASP and CBPP. CLASP is the Center for Law and Social Policies. CBPP is the Center for Budget and Policy Priorities. Or the Georgetown Center for Children and Families. I think those three groups in the health and early childhood space. And some of the work from Pritzker would be helpful from the Texas center that they have. But from the administrative standpoint, just CBPP and CLASP, I think, could offer some really good administrative resources, just as we think about like enrollment and things that Medicaid could change in a tangible way, I think might be helpful to reduce burdens that people have with accessing services and navigating bureaucracy.
Yeah, we're happy to facilitate connections or with those national experts. We work very closely with CLASP and CBPP. And one other area that I didn't hear mentioned earlier was sort of like the nexus between housing and healthcare. And we've worked a lot with CBPP on that issue.
Cool. Yeah, and if you have other ideas that you didn't hear, please jump in right now. So I think the more this can be.
Yeah, absolutely. Another recommendation around like the broader like sort of social determinants of health and especially engaging providers around social determinants of health would be the Camden Coalition, which is a group that focuses specifically on complex care populations and is like a coalition of providers focusing on high need, high cost populations and strategies that are effective for reaching them. Another suggestion for a state that might be great to bring in, so Tennessee had their Building Strong Brains initiative, which was specifically around taking like a really like holistic approach to preventing trauma and adverse childhood experiences, which we're working very closely with them right now. So that might be a good state to bring in to speak around sort of this like holistic perspective. Can think a little another possible like around sort of the workforce piece, the Penn Association on Community Health Workers, where they've assembled like a really robust evidence base for community health worker interventions and how they can be effectively implemented. So we've worked pretty closely with them and lots of other suggestions around social determinants of health, but I can follow up with those later if that would be helpful.
Yeah, that's wonderful. I think the CHW piece I think has a lot of potential.
Could also consider bringing in physicians who specialize in this. So I know one who I know personally who I'd recommended earlier was Dr. Willie Lawrence. He's he's Harvard Med educated, longtime not presidential advisor, but he has co-authored the presidential advisory report on the social determinants of health. So individuals like that could come and maybe give presentations.
Absolutely. It seems like, go ahead, sorry.
Do we have any, when we're, if we're asking the question of what type of experts or what type of information we need to gather, do we have any data as to, what sort of health needs are like skewed more heavily towards, minority or underserved populations? Like, are we looking at, I mean, or is it just kind of everything? I mean, are we looking at, do they tend to need more, like, are we looking more at like emergency services? Are we looking more at like diabetes and preventative services, or is it just kind of all over the place? Do we have any data on that?
Well, I think it's a really good grounding, which is maybe how we think about starting this as a group, which is grounding ourselves in data, which is probably a good piece, and we can maybe map out further. We could probably rely on the Kansas Health Institute as some resource to present on some basic like health status data, just in really to the point where I think, and then to present on some disparities that exist, so that we might be able to start thinking about like what could be the most impactful things for us to focus on and make recommendations that might not necessarily be like top of mind because they're not like as visible, but they might be really smart public health recommendations that we could make. So, because there's probably short-term approach and the long-term approaches like ACEs and early childhood, so that we have the lifespan of somebody. So I think that's a great suggestion, and maybe we'll look at KHI. I'm sure there's some national groups that we could think of bringing in, whether or not it's like University of Wisconsin Population Health Center or Shweeta, I don't know if anyone comes to mind for you on some of this sort of macro level data that might help us create a map.
Yeah, absolutely. There's a lot of academics that focus on social determinants of health that we could engage. We recently just had a convening around the social determinants of health where we engaged two professors, one of them at Johns Hopkins, one of them at University of Chicago, who specifically focus on intersection between social determinants of health and chronic disease. And that could be a really interesting area as well, and like sort of health disparities and equity. So I can send along their names. One of them is Dr. Hilbriggs, who's at Johns Hopkins, but I can send along their names. And one suggestion I had, NGA has published a lot of different publications on social determinants of health and how different states have implemented social determinants of health related interventions. Would that be helpful? Like, we've created a number of different toolkits on how states have managed to pay for social determinants of health related interventions through Medicaid. Would that be helpful if we sent those along?
I think that would be great. I mean, the two states that I was looking at and please tell me if there's others, but that I've sort of understood to be leaders is North Carolina and Michigan, in terms of they've tried to orient some of their payment in Medicaid in very innovative ways towards social determinants of health. And does that track with what you're thinking? And I'm sure there's others that have done pieces, but I know North Carolina and Michigan have been pretty aggressive.
Yeah, North Carolina is definitely the national leader with their Healthy Opportunities pilot, and the fact that they managed to weave sort of paying for non-medical interventions through Medicaid into their 1115 waiver. And Michigan is especially sort of in the lead with data integration. They've created the system called Care Connect 360 that is really effective at integrating data across behavioral, physical health, and also social and economic support areas. Another state I would flag is California, where they've have whole person care pilots that focus specifically on people with really significant needs across a variety of domains. Also Rhode Island, where they've managed to create Medicaid health homes specifically for very high need people that weaves different services together. And another would be Arizona, where they've managed to do really like effective integration across physical and behavioral health, and also social and economic support needs. And we can share examples from all of these states. But yeah, those would be the 4 or 5 that would really stick out. And we've worked really closely with all of them. So we could definitely reach out and try to bring speakers from any of these states on.
That's wonderful. I think that's great. North Carolina also has, I think, very strong early childhood system in terms of some resources, and they house some national groups but this may go towards, it's like these buckets, right? It may go in the education bucket or it may go in the economic supports bucket, but they offer like some really cool subsidy programs to their child care providers, both scholarships and wage increases to help make sure you have quality child care. So there's lots of cool things depending on how we wanted to separate the groups out between the 3. So this is really
I just wanted
exciting.
to make one last suggestion. I'm sorry that I'm talking so much.
No.
specifically what you said around provider cultural competency, Oregon has a very unique sort of system of CCOs, coordinated care organizations, which is like a value-based arrangement where they have a variety of incentive-based measures where the CCOs are paid more if they succeed on a variety of metrics. And some of these metrics are related to provider cultural competency and language access, and they are about to introduce a new metric around the social determinants of health. So the fact that they managed to turn equity and social determinants of health into value-based metrics may be a model that is interesting. So that's another state that might be worth looking into.
I think that's really great. Sort of along those lines, but not connected. I know before in the first phase, Commissioner Velarde and I talked about this. Like it was, we were trying to take this on, but it was too much into the first phase. I know Washington State has done like added on like an equity assessment to like all of the bills that are tracked by the legislature. So in addition to a fiscal analysis, there's an equity analysis. Are there other good like models from other states that are doing like equity impact analysis?
Yeah, another example would be actually Oregon, where they've
Cool.
incorporated an equity lens into all of their policies. And I think they were inspired by Washington. And a third state I would add is Virginia, where they've built out sort of in response to COVID, built out an equity leadership task force, which is engaged in every aspect of emergency planning. And there's like an equity lens present at every aspect of emergency planning, and it's led by the chief diversity officer, who is a cabinet level official and reports directly to the governor. So we've been working really extensively with Virginia around this structure. So we would be happy to connect you with the leaders in that space.
Awesome. That is, I mean, I think that if our other people are interested, as we think about the system, like at least calling out what disparities are, I think it's an opportunity to like, if we're analyzing budget costs, like to talk about or to look at what other states have done to analyze like what legislation looks at and how it impacts disparities and equity, I think would be like us collecting the data that makes sense. So I don't want to sort of be the only one that wants to go there, but to me, it seems like it could be a really interesting thing to explore.
I agree. And also, I don't feel bad about talking. I'm a big fan of, not reinventing the wheel. And if there are other states that are already, excellent models of this work, I'm happy to learn from them.
Yeah, definitely. And Kansas is never one of the leader states, right? Kansas is never a leader. I mean, I don't mean that in a bad way, but we're usually like on the good side, like 11th or 12th state to adopt, or on the bad side, we're like 31 or 32. But it's great to learn from what other states have done. Like there's great models out there, and like I think it's exciting. I think we're going to wrap up in about 4 minutes. So any other sort of ideas on speakers or topics? I think we've gone through a lot of great ideas.
I don't know that there's anything else I can think of. Like on the issue of intrafamilial violences, are there any like particular like agencies or constituencies that we want to talk to?
Locally, there's the Kansas Coalition for
with some names. Yeah.
Go ahead, Chief Ramsey.
Yeah, I have some names that I could provide to the group, and we could decide on if there's any in particular we'd like moving forward.
Great. And I pasted the list of the folks that were submitted to us in the chat. I think all of them look like good folks, and I think just figuring out how to integrate them into some of our grounding. So at the high level, if I'm getting this right, there's the agreement that, our goal should be looking at how can we improve our system to better meet the needs of underserved and underrepresented populations, recognizing that we should be looking at administrative, legislative, and financial recommendations that can improve services and sustain services. Is that a fair way to try to capture some of this?
I think so.
I'm just trying to think of how we summarize it for the report out.
If I think you got it.
Any other thoughts before we sort of like go back to the big group in the next 2 minutes? I mean, I'm thinking in terms of next steps. I'll try to get with Stefan and Shweta, capture this list, and I'm sure incorporate whatever we talk about next, and then we can circle back to see how we might want to sequence it in terms of structuring the actual meetings and also finding the speakers, if that makes sense.
That works.
Do we know if there's like any goals for like interim reports? And we can ask this when we get back, interim reports and then a full report, like a different timing. We should just be conscious of deadlines that might exist.
I know that the next full subcommittee meeting for healthcare is supposed to meet March 11th. And I know that I believe there was a statutory deadline, I may be wrong, of July 1 for a second report. So that may be the timeline, but don't quote me. We can check that.
Perfect. Well, this is exciting to me.
Yeah.
So David, when we go back to the full group, are you comfortable just giving a small debrief on our goal and what we're thinking of in terms of moving forward?
Yeah, I'm comfortable. And
okay.
Catalina and Chief Ramsey, jump in if I didn't capture what we talked about. So hopefully I'll do it justice.
I think you got it.
We'll just say talk to the NGA.
Yeah.
My dog is snoring now.
Well, we have a minute to wrap up. The dog, it's been great to have a dog, but they can go crazy in the middle of the night, and I'm not used to being disturbed like that. And they could just not know they can't knock over the 15-month-old. That's the other thing.
I've got 2 older girls and a dog she's now 2, but I think she's going to be one of those like eternal puppies that just no matter how old she is, she's just always going to have a puppy attitude. She's certainly the sassiest thing I ever did meet. So
It's like the cutest dog I've ever seen in my life.